Welcome to this DevX Google Hangout on Health System Strengthening. My name is Michael Igo. I'm a senior reporter at DevX. This online event is part of our ongoing Healthy Means campaign, an online global conversation advancing the discussion around future challenges and opportunities in global health, with partners including those represented by our fantastic guests here today. So let me take a minute just to introduce them, and then we'll launch right into our discussion on this important, very timely topic. So from Gavi, the Vaccine Alliance, Maz Siddiqui works on the private sector partnerships team, focusing on creating partnerships that strengthen the immunization supply chain and address issues of coverage and equity through social mobilization. From GSK, we have Ramil Burden, who's the Vice President for Africa and Developing Countries. Ramil is responsible for external affairs, communications, public health and access programs for Africa, in addition to being responsible for GSK's operations in Bangladesh, Myanmar, Cambodia, Laos, and Papua New Guinea. From Janssen Global Public Health, the pharmaceutical companies of Johnson and Johnson, Jamie Taylor is Senior Director for Global Access Policy. In this capacity, she leads efforts worldwide to shape public policy and public-private partnerships in ways that meaningfully improve access to healthcare, particularly for individuals and communities in resource-limited settings. And from the United Nations Population Fund, we have Dr. Senan Houghton. He's a Senior Reproductive Health Advisor, providing technical advice on maternal health and family planning throughout UNFPA's flagship program on contraceptive supplies and maternal health life-saving medicines. Dr. Houghton is also a trained medical doctor who practiced in Benin, West Africa, and held positions in other UN agencies prior to joining UNFPA. Thank you all so much for being here this morning. Really appreciate it.
Thank you. Thank you.
So we're going to discuss health systems and health system strengthening, an issue that has risen to the front page of the world's newspapers in recent months, perhaps to an extent it never has before, as nations and organizations consider the factors that facilitated the spread of Ebola through 3 West African countries and prevented its spread through many more. So just to begin, and I'll direct questions to one speaker at a time, but encourage all others to weigh in. Let's take a little step back. Ramil, what are we talking about when we talk about a health system? And what do you see as the components of that system that are typically weakest? What is it that needs to be strengthened when we talk about health system strengthening?
Sure, thank you. I mean, I think the first thing to say is health systems are incredibly complex. So there isn't one thing that's called a health system, and each country will have a completely different health system. So I think the first thing to say is, you know, the systems we're talking about are unique to their own countries. They may have similar features across countries, but to have one health system for any number of countries simply isn't the kind of right approach. So I think we need to bear that in mind. There are, from my point of view, I think 2 or 3 really key elements that we need to focus on, and there will be bits that we can strengthen that are very obvious. So the first, I think, is any health system is really made up of people. So whether that's healthcare providers, community healthcare workers, the Ministry of Health, the government, the NGOs that work on the ground, etc., etc. So I think the first thing we must realize is that healthcare systems are made up of people. So and that's a very complex group of organizations that have to work together. So the first thing is human capacity, knowledge, experience, skill. Do we have the right people in the right places with the right skills doing the right things as an ecosystem? And to have that to really work, you need to have a overarching vision or strategy really owned and embedded by the Ministry of Health, for example. Once you have that, and then a willingness to have a partnership approach, then I think you can start to see that the healthcare system and its components start to work together. So I think you know, the areas from a pharmaceutical or vaccine company's point of view that we would focus on is the human bit, so the skills, the knowledge. Do people understand what the latest protocols are for treating diseases? Do people have the right of understanding themselves as individuals in a country? So do they understand disease themselves? Do they understand how to access healthcare? Do they understand how to get referrals, etc.? Very key component. And then from as I say, from a pharmaceutical and vaccine point of view, the system has to be able to sustain quite a complicated supply chain into quite complicated and difficult places. So what I mean by that is, if you have to have a cold chain, for example, so to keep vaccines within a certain temperature range so that when they are given to a child, they are within the required regulatory approved temperatures, you might need a cold chain that stretches all the way through to very remote places in very warm areas. And to have that cold chain, you need to have a lot of technical expertise, you need to have record keeping, you need to have people with the right skills and knowledge and understanding to deliver all of that. So I think the healthcare system as a whole needs coordination, it needs people, and it needs partnerships between the NGO world, the government world, and the private sector. In terms of, I think from my perspective, in terms of Africa and developing countries, I think all three of those areas can be strengthened. But I think ultimately you go where the place where it has the maximum impact and where the maximum need is right now. And from our perspective, that's really around what we would think of or call community healthcare workers. So really people who deliver fairly basic healthcare information and delivery of healthcare to populations. But what they do is they not only do they deliver healthcare, but they also deliver education. That's a key area, I think, is very key, is this supply chain bit that I talked about just a minute ago around how do you strengthen supply chain so that medicines and vaccines are available not just in the urban areas but to the remote areas, and are controlled from a quality point of view, so that that vaccines, for example, have been kept in a cold chain.
Great. Yes, terrific. So there's a lot there. Health systems are complex. They're made up of people. And you mentioned the aspect of partnership, which I think is something that we'll certainly want to dive into during this session. But do others want to weigh in on sort of broadly how you conceptualize a health system and where you consider to be the entry points that are available and needed for health system strengthening?
Yes, I completely agree with Ramil. Health systems are very complex. I mean, in addition to what he mentioned, I think it is important to think, when you ask the question about the component, that we need always to have a health system thinking approach. What I mean is, there are various components. I mean, in addition to the component that Ramil mentioned, financing is a very critical component, particularly for developing countries. And he touched also upon the data, mentioning the record keeping. But the data, to be able to know whether or not we are affecting the people, is also critical. But when we are looking at the health system, from my experience, from a practitioner to public health program manager, I think one aspect or mistake that we often make as a developing agency is to look at some component of the health system. We might be, for example, investing on human resources for health, or we might be touching of a critical piece of logistics and supply chain management, but we often overlook the interaction, the interplay of each of these components. And when we are investing in one component, both the intended and unintended effect that they are having on the other component. So when we are addressing a health system in the developing world, particularly, it's important to have this comprehensive overview of the health system. But I would like to finish by saying that just like Rami said, health systems are made for people. And if you mentioned the example of Ebola, if you look at most of these countries, the ability of this country to face the challenges, whether it is Ebola, whether it is climate change, or the flood situation, or the drought situation that they often have, the health system are not prepared to withstand of these challenges. So I think we can contribute in this panel in trying to identify some of the key aspects that we can put in place in terms of preparedness for this health system to be very resilient in this context.
Great, thank you.
Yeah, this is Moz here from Gavi. I just wanted to sort of echo again the comments made by Ramil and Senan in terms of, you know, the components of the health system. Obviously, we understand that the people are the foremost, the building block of that health system. Just to touch upon and to build upon the comment made by Senan about health financing and understanding that there is a need, especially when we look at countries affected by Ebola. You know, Gavi has been looking at this and looking at this carefully and understanding that there is a need to actually provide, in addition to the support we provide Gavi-eligible countries, in additional financing. So we're looking at, you know, providing up to 50 million to the countries affected in Ebola, US dollars, to really strengthen those core components. So we're looking at the data, we're looking at about the supply chain, we're looking at the people as well, to making sure that they have the appropriate training to enhance the existing training as well. So we need to understand that there's a lot of work already going on within countries, and I think you understand that. And I think the role of organizations across the public and private divide is really to build upon the competencies that have already been developed within those systems and enhance them where possible, and to trying to allow countries to take ownership to plug those gaps where they see they fit.
Great. Jamie, Taylor, I'd love to hear your thoughts on this question as well, but I wonder if we could also sort of transition your comments to address that question of partnership and how we forge effective partnerships to strengthen health systems, perhaps particularly between the public and private sectors. So feel free to address this question of what is a health system and where are its entry points more broadly, but I'd love to hear your thoughts on partnership and how to make them work.
So I think that these questions of partnership are critical as we look at the Ebola crisis right now and the lessons that it's taught us. Certainly, West Africa isn't the only area of the world in need of stronger health systems. And I think it presents an opportunity right now for the private sector to look at where there is not that firm foundation, those core competencies as we've heard about, and look at these key components of health systems and see where gaps lie and remain and where we can fill them. I think the financing issue is incredibly important as we go around the world, as we bring our own experience at Janssen and Johnson in working across health systems globally. There are many best practices that we can bring, so from a capability standpoint and a learning standpoint and a teaching standpoint, there's a lot of intellectual capital that we can provide. I think that being creative about new financing mechanisms that include the private sector, including social impact bonds, development impact bonds, and the many variations thereof, provide some opportunities, again, to fill those gaps. And I think that we really need to focus on building those firm foundations and building from firm foundations. One concern I have stems from just the fact that there are not steady and steadily increasing domestic healthcare budgets, that we see influx here and drop off there, and I think it creates a tremendous amount of disruption for many health systems around the world. Where we can anticipate that disruption, where we can anticipate those drop-offs, therein lies, I think, many opportunities for private sector and social sector parties to come and, again, fill gaps. So gap filling is really, I think, a watchword for us at our company as we look at where we might be able to contribute and uniquely contribute, and as we bring to bear our many capabilities, our deep bench of capabilities that include intellectual resources, certainly human resources across our deep bench, as I mentioned, as well as some financial resources and creativity, I think that we'll be in a much better position to build the cross-sectoral kind of partnerships that are necessary to ensure, again, the firm foundations and resilience in health systems that face a lot of instability today by virtue of the way that we've worked in the past.
Great, thank you, Jamie. Do others want to weigh in on that question of forging partnerships, public and private partnerships, other kinds of partnerships? Just sort of, what are the characteristics of a healthy, constructive partnership in health system strengthening?
If I may, Michael, yeah.
Please.
Yeah, I think looking from my perspective, and specifically what Gavi's been involved in sort of strengthening and trying to understand how to strengthen the immunization supply chain. We're working obviously with our partners at WHO and UNICEF, the World Bank and the Gates Foundation to come together and understand that when you're looking at forging public-private partnerships, there is an education aspect that needs to go on before these partnerships happen. And what I mean by that is that certain industries are very aware, and I think the pharmaceutical industries are quite aware of the acute problems within the supply chain. But when we're looking at broader, when we expand that industry sector to telecoms and we expand it to logistics providers, there needs to be a greater understanding of what is what are the demands and what are the constraints of working within the public health infrastructure and the architecture within the country. And there's a role, obviously, then to educate and to inform ministries who may be skeptical at some point, or there is some resistance to working with the private sector. And I think organizations, not just Gavi, but global organizations actually have a role to convene these stakeholders together and to make sure that they effectively bridge those miscommunications and be quite transparent about what are the challenges when you're looking at forging a partnership between the public and private sector. I do think that, echoing Jamie's points, it's really not just down to, I think that the thinking where the Ministry of Health or government is the only stakeholder in this sort of in this arena is now hopefully more of a antiquated thinking. I think we need to be very open and collaborative, working with industry, civil society, local private sector organizations as well as global private sector organizations to understand, how can we ensure the sustainability of programs that and partnerships. Mm-hmm. I think having those organizations on the ground level as well, who understand the country demands and some of the challenges working within a particular environment are important.
Can I add 2 words to that?
Please.
Yes, because I completely agree with Moz. The key word here is sustainability for me. In the area that we work, maternal health and family planning, we can always count on private sector. For example, they have corporate responsibility. We have philanthropy group out there, but a sustainable model is a model in which you have 2 principles. There is a win-win situation, and there is a business case. And what we have found, for example, two quick examples I will give you. The example of using Unijet in contraceptives, for example, or even in vaccine, and Moz can speak on that. Because if you think about it, a great barrier in the developing world is to have health workers to do the injection, the number of health workers, but also barrier from male in the relationship, preventing women to have access to contraceptive. So if you take diabetes today, for example, people can self-inject the insulin. And so to be able to have this technology available in the contraceptive arena has worked very well with partner. We've been working with Gates Foundation and other private corporates, not to name any of them on this panel. But A second one is the partnership that we develop with Intel Corporation in learning, to develop e-module learning for midwifery in remote area, and using the school platform software to develop module, so that when we have a midwife sitting in a very remote area, she can update her skills and her competencies and serve the population. So those key aspects, sustainability and having a business case, are very critical.
Can I just say a few words?
Please.
I'd like to start really by saying, so this may be a half full glass comment, but it seems to me that appreciation of partnerships and a growing sense that organizations can't do things on their own, and that therefore they have to non-traditionally, organizations that don't necessarily work together, they have to work together. So the example I would give you is GSK working very closely with Save the Children at a kind of global corporate level. 10 years ago, Save the Children would not have really wanted to work with us. I think they openly say that. But they now recognise that the unique capabilities of a private sector company, the unique capabilities, expertise, on the ground can make a difference. So they're much more. So there is this, I think, a growing desire of organisations to want to do partnerships. I think, just to echo some of the comments, particularly like as Sanan has just mentioned, I think the challenge isn't so much now, although it is still difficult to create partnerships, the challenge now is really embedding them on a sustainable basis in places where they will have a life of their own, and that you can scale them or replicate them somewhere else. Because it's easy. I think the world is full of wonderful pilots. In my own company, we have lots of great pilots, whether it's with other private sector organisations, whether it's governments, whether it's NGOs. They are all fantastic in their own way. The challenge will be the long-term sustainability and the impact it has on the business model in various countries. And I think that's the next challenge that we would. That's really the challenge of partnership. So I would say, we have I think we're getting to a place where NGOs, the private sector, to a large extent government organisations, both above country and also national governments, are increasingly recognising that we have to work together because the challenges we face are just far too big, and that borders don't really exist, particularly when it comes to health, and so therefore you have to cooperate. We're finding ways of doing that. I think the real challenge is, how do we share all of that learning? How do we scale it up? How do we make it sustainable? How do we make that a real change to the way that we do business?
Thank you, Ramil. Maz Siddiqui, let's follow up on that point a little bit. This question of a sustainable partnership. What changes have to happen in terms of business models, in terms of flexibility, in terms of learning for private companies and NGOs and the public sector to be able to build those lasting, large-scale partnerships? Where do you see this going?
I think, yeah, thank you for that. And there's an interesting comment here. I think when you're looking at engaging the private sector, and I'll speak to that, we need to be careful that we need to firstly understand that there is a valuable way in which corporate social responsibility can play in supporting programs or initiatives through funding or through technical expertise. But I think, and this is probably what we might be touching on, is actually trying to move away from that to the shared value, or in a situation where there is potentially a commercial incentive for organizations to continue to develop or continue to build upon projects or pilots, as Ramil pointed, and when they realize there's an evidence base for that, that will help to provide the business case for private sector to continue to develop. And I think that before that, we actually need to make sure that it's filling a need within the country, and we need to make sure that the country needs are clearly identified and articulated, and then the private sector responds to those needs. An example of the project that we've been working on with Vodafone is to really develop an M vaccination application, which basically captures data effectively within the lower levels of supply chain within Mozambique. Now, this is a commercial enterprise that has been facilitated by Gavi through a mechanism through which contributions are matched financially through something called the Gavi Matching Fund, and this provides more of an incentive for private sector organisations to build upon that. And I think if we move towards, and I think that's the challenge when we're looking at working with private sector, is we need to try and transition away from corporate social responsibility, or identify what the role of corporate social responsibility can be to potentially build upon, to build these models which can be scaled into a commercial enterprise. Because I think that's what we're looking at in sustainability. For an effective, for an effective partnership to develop, there needs to be something on both sides of that. That is a very challenging. That's a very challenging thing to do, and there's a lot of political concerns around that, obviously, and we need to be very clear and transparent about how organisations are engaged in activities which are commercially driven. And and then we need to be clear that there are some areas within the supply chain, for example, that are not appropriate for the private sector to be involved in. But what we can do is learn, and I think what we're doing at Gavi and certainly other organisations as well, is trying to learn about some of the comparative advantages. And I think there's a lot of talk about innovation, and that people automatically talk about technology. And I think there's more than that, really. And I think technology has an important role to play, but there's an innovation process and methodology that can be applied to, and I speak to the immunization supply chain, to how you redesign, for example, how a supply chain is structured. There are a number of organisations who've been doing this for very successfully in the commercial sector, and I think the trick is for organisations such as in our space is to adapt that thinking to the public sector context where it makes sense.
So I'd just like to emphasize this point about organizing for the long term. As a private sector entity, I think a lot of us in companies have built over time very robust CSR groups. But our question in my company at Johnson & Johnson, Janssen, the pharmaceutical companies, is can we move that CSR sensibility from distant from the business to deep within the business? Can we take that from the margins to the middle and really begin to imbue in our culture as a company a mindset that's driven toward global development? Can we empower the many tens of thousands of employees that we have within our company to begin thinking beyond core markets, or begin thinking in new ways that necessitate collaboration and bring their own creativity to it? Can we validate that on the business side? And we've launched in our own organization a test case of this, hopefully much more than a pilot, that really seeks to redesign our business for the long term, for global development, for maximum impact and maximum good. And we've, 1 year into it, have seen this transformative effect on our culture as a business. It's when we think about triple bottom line, we believe we're really realizing it, and for the first time demonstrating, to the point about business case and sustainability, we're beginning to demonstrate that investment in global public health can be truly a growth enabler for the business, which 5 years ago may have been cast off as a pipe dream or a fiction, but today, because we're bringing our business mindset to it, because we've empowered the business to bring its best talent to the problems of global public health, we foresee great things in the future for the larger world, for the patients we serve, and even for our business. So we look forward to realizing that trajectory over time. But it is about organizing for the long term, and it's incumbent on us as private sector entities to see these collaborations and our participation in this space as much more sustainable, much deeper, and going far beyond, to Ramil's point, far beyond a pilot model, that is served us well in some respects, but that bears an evolution at this point. So we look forward to carrying that evolution forward with longer-term projects toward longer-term capacity building.
Great, thank you, Jamie, for raising that point and your experience in that area. And I think, you know, we have a tendency to think of partnerships as maybe between the private sector and the public sector, or between a company and an NGO. But we also have to think of partnerships as across sectors, possibly even within one organization. So, Senan, I know you had some thoughts that you wanted to add to this as well, but I'd love to discuss a little bit how we can enable that sort of cross-sector collaboration that, you know, draws on the skills that finance experts, technology experts, you know, all sorts of aspects of a large international business to build out those health goals. So not just partnership between different kinds of organizations, but partnership across sectors, within organizations or within groups of organizations, also seems to be critical. And I think Jamie has really framed that issue well for us. So, Senan, do you have any thoughts on any of these questions that have come up?
Yes. First, let me say that the cross-sector collaboration is a must if we are to build a resilient health system, the topic that we are discussing today. But before I come and elaborate a little bit on that, let me just take 1 minute to add to the thought that the colleague have mentioned. In terms of challenges from where we sit at UNFPA, for example, one challenge in the partnership that we observe with the private sector is the volume guarantee that is necessary to meet the business case. That's one. Because we can elaborate longer that, but the other is the timeline. Before we declare an investment a success or a failure. I mentioned a couple of examples at the beginning of this hangout about some investment, and quite often the capital investment is one thing, and that can be easily matched. But the other investment in terms of building capacity in the people, talk about those who will be doing the service delivery. Those needs to be picked up either by government or by development organization, and quite often we have some challenges on those ends. But going back to the cross-sector collaboration, just to pick the case of Ebola, because it's really illustrative of the importance of cross-sector collaboration. If you think about I've had the opportunity to be in a few of these countries before the Ebola crisis. The part where we have the most hit of the epidemic is, not surprisingly, this part of this country where you have fewest health facility, you have lack of water and sanitation in even the existing facilities. So the collaboration, you can already see that there is a disconnect between the health sector and the usual sector that deals with water distribution, sanitation. Even when you come to roads, the access to these facilities is also very difficult. So when we think of a resilient health system, it is important, yes, to think about the health sector, but how are these linked with other development sectors? I just mentioned the road, I just mentioned water and sanitation, but how about innovative financing to chaperone all this and making sure that we have the funding that is necessary to do the investment? Regarding the internal partnership, even within an organization, you have different aspects. I was at the WHO regional office in West Africa before I joined UNFPA, and I was in charge of a regional program for outbreak investigation and response. It's not a surprise, you will know, maybe if you look and research on that topic, it was not a priority for the country. We were talking about preparedness of the health system to face such of epidemic in our region. But because it has not happened at that large scale, it was not seen as a priority. So even within an organization, you need to often make a case to build a resilient health system. So those are some of the thought that I think we need to think when we are thinking of building resilient health system.
Great, thank you. Do others want to weigh in on this and perhaps share some constructive thoughts on how we can overcome the specific challenges that Senan raised in his comments?
Yeah, just to build upon that. I think there's a lot of this that we mentioned before, building the case, and I think the building the case for investment and building the case for cross-sector collaboration, not necessarily in the private sector, but specifically I'm speaking to the private sector. I think it requires the understanding from the private sector, and I'll speak about sort of working within industries, working within organizations in a minute, but it requires a private sector to actually have that vision to see that this is a long-term investment into future operations, whether it be in emerging economies and emerging markets. For vaccines, for example, the business case, the economic benefit really is quite clear. You invest in the future of a population that could be running your workforce. That's one aspect of it, but also we've seen through the recent outbreaks, the upsurge in polio in certain countries, and also Ebola, that diseases don't have any boundaries, and it's incumbent upon, and queuing comments as well, it's incumbent upon organizations to really understand that. So you're really investing in you're safeguarding the future of potential operations in protecting countries, but also protecting sort of the population within countries. And that's the first point. On the second point of working, I think there's also a greater need for organizations to work closely together as well. So obviously, with Gavi, we obviously, the alliance is composed of WHO and UNICEF, as mentioned before, but also, can we learn from UNFPA in terms of how they've engaged in their operations? Can we learn from other organizations who are facing the same challenges? I'll talk again to supply chain as an example. Can we learn how they've been engaged in there, and not just engage the private sector, but also increase sort of political commitment within countries to increase budgetary spend on the Ministry of Health, and how that advocacy component plays out as well. And I think there is a role for industry partnerships, but also there's a greater role for organizations, sort of the multilateral organizations, to work close together. And there is obviously a huge amount of work that's already gone there, but I think that needs to be strengthened as we. And I think the intersection of that strengthening, really, the gateway would be the health system. You can have a vaccine supply chain, but the same routes, for example, will be used for other health commodities. So increasingly, we're looking at integration about those different supply chains and the different processes and how they work together. Similarly, when we're looking about advocating for greater inclusion of the private sector, or other organizations have been involved in this outside the health sphere. So how can we learn from that? And I think it's exciting, but there's a lot of opportunities to really build upon existing practices and existing successes from other aspects outside the health sector, for example, in agribusiness.
I just wanted to say, to your point about private sector organisations in different sectors working together, I think from our point of view, there's a huge appetite from other sectors to work with the more traditional health sector, so companies like us, from the financial sector, from the mobile phone sector. We've just heard about from Moz the program in Mozambique with Vodafone, which Gavi is supporting, we're supporting as a vaccine manufacturer. That's a really good example of different sectors coming together, holding hands, seeing if something works. But then if it does work, we know that Gavi, us, others will be talking to other governments and saying, look, we've got some really good M&E here, which shows that you can increase vaccination coverage, reduce costs, etc., etc. That's a really good example of two different sectors, so vaccine manufacturers and mobile phone companies coming together. And there are lots of other examples we're working with, and I'm sure Janssen are as well, with with banks essentially and other financial institutions. And I think this is really the exciting area where real innovation is really taking place in terms of the business model. The big challenge, I think, is these things take quite a long time, because for Vodafone to understand GSK's business model and for GSK to understand Vodafone's business model is actually quite complicated. And for us to kind of have a common understanding, a common set of objectives, takes quite a long time. And I think people need to realize that takes a long time, and you have to invest quite a lot to get there. Yeah. I think to reinforce my earlier point, I think the challenge really is scalability of these things, replicability of these things, and sustainability of these things. I mean, to Senon's point, I think making the case that these are sustainable because they are a part of the core business of those organisations is really the key thing. And the way that we have approached it at GSK, and I talks to some of the points that Jamie was making, was that you have to take a long-term view on these things, and you have to change the incentives inside the business. So we, for example, have taken a 10 or 15-year business horizon in terms of our footprint in sub-Saharan Africa, for example. We've also incentivized or changed the incentives for our general managers and our senior leaders so that they're focused on reach of population. So every single general manager in our markets has an objective of reaching 80% of the population in their country. So not a short-term target, a long-term target of reach, which makes them think about how do I widen access, who do I need to work with, how do I increase the network of distributors, the network of pharmacies, etc. So it's difficult. You need different. You need to understand each other's business models and objectives. You also have to challenge yourself as a private sector organisation, and really carve out a different business model, which is essentially what we're doing for sub-Saharan Africa and developing countries in GSK, which is take a long-term view and have incentives that are aligned with that long-term view. And maybe we're lucky as a multinational company we can take that long-term view, but equally we're in a business where it takes 10 years to develop a medicine, it takes 10 years to develop a vaccine, it takes 5 years from us starting to build a factory for anything to come out of that factory. So our incentives and our mindset have to be aligned with that, not with quarterly reporting, as important as that is. 4 times a year, etc., etc. So I think that's the other key part to this partnership piece across the private sectors, is finding organisations that have that long-term mindset and approach and that permission to really find innovative ways in the business model to have an impact, which might be 10 years from now.
Thank you, Ramil. I think it's a great point, an important point, and clearly a difficult one. You're talking about, many of you are talking about making the case. You're talking about shifting priorities within organizations that are perhaps conditioned to look at shorter-term definitions of success. So when you're making that case, what do you point to? How do you demonstrate that this longer-term vision of a stronger health system is returning something on the investment, particularly given that one of the core functions of a health system is to prevent negative things from happening? Where do you draw your evidence base? What's the positive vision that you can point to?
Michael, can I give a very simple piece of experience that we have at GSK? So about 5 years ago, we agreed a policy of reinvesting 20% of our profit made in the least developed countries back into frontline healthcare work, training, and capability building. And so the way we did it was we approached Save the Children, AMREF, and CARE, and asked them to deliver programs for increasing the number of healthcare workers in the markets we were working. That sounds great. We're giving a percentage of our profits to do this. The way I justify this from a business point of view now is that the profits we make in those markets have gone up. So there's not a direct line between what we've done, and I can show you, but the total sustainability of the business has increased. And so every year, actually, since we started that program, we've increased the percentage of profits that have been ploughed back into the healthcare worker program. So when I'm asked to show the benefit of the 20% reinvestment program, we've got all sorts of statistics about the number of healthcare workers that have been trained, the number of lives that have been touched, the number of children, etc., etc. We also have a very simple statistic, which is the total quantum we put in every year goes up because the total quantum of profit we make goes up. So for me, this is the classic case of a rising tide lifts all boats. So I give you that as just a concrete example of one of our experiences.
Great, thank you. Do others have similar or different experiences to share, or similar or different ideas about how to make this case?
Yeah, can I?
Please.
Yeah, I mean, shortly, and I simply, like Ramil also mentioned, I mean, for us, it's all about the people. For example, you take our organization, the United Nations Population Fund, it's very simple. We said every pregnancy is wanted, every birth is safe, and every young person potential is fulfilled. What does it mean? That means that we want to make sure that when people decide they get pregnant, only when they decide to get pregnant. So, for example, we have within the partnership of the Family Planning 2020, we want to see if we are reaching more women having access to contraceptive, particularly in the developing world. So when we are having new acceptance of family planning, we know that we are doing something. We are reaching the people. Every birth is safe. When we are having lower maternal death, when we are having fewer newborn deaths, we know that we are reaching the people. Every young person potential is fulfilled. We are working with partners to empower the adolescent, particularly the young adolescent girl, because our vision is if we invest in the 10-year-old girl, we can transform the future of community, of family, of societies. That 10-year-old girl, if we are able to make her stay in school, so for example, we will measure the drop rate in secondary school. If that drop rate is falling, we know that we are making impact. So very simple, a way that we can know actually if we are affecting the life of the people that we serve.
Great, thank you, Senan. Unless anyone else wants to weigh in on that specific question, I have one final question, and I'd love to hear all of your thoughts. It's sort of a big one, so feel free to focus in on one particular aspect of it that perhaps you can draw from your own organization's experience. But I'm interested to hear how do you see the roles of the public, private, and NGO sectors changing in terms of how they can best support health system strengthening in the years to come?
I think we're already seeing a movement toward this almost mass hybridization of these sectors that you named. And I know we talk a lot about collaboration, but collaboration to be successful depends on leadership. And I think from the private sector, at least from my company, you'll see us advancing a new brand of leader. We've realized, as I think others have, that traditional business leadership that's been customized for the private sector and private sector only, won't allow us to grow in the ways that we need to grow as a business. It won't allow us to participate fully and have a full impact in this hybridization movement, this shared value movement, that's the opportunities from which are very obvious. But in order to capture those opportunities, again, we need that new brand of leader. We need cross-sector leadership. And we're beginning to delve in that in concerted ways. We've participated most recently in a cross-sector leader fellowship sponsored and driven by the White House in the U.S. The White House Office of Social Innovation 2 years ago said, we don't have the brand of leader that we need for the 21st century. We don't have a cohort, a collection of leaders who understand the specific skill sets necessary for cross-sector leadership. So our participation in that program and this dissemination of a new set of skills, a cross-sector mentality and cross-sector leadership skills, which includes a multilingual component as we speak the language of other sectors, a long-term component as we look at sustainable leadership, all of that will be key. We hope to contribute to case studies in this area going forward and the success of a cross-sector leadership model that we hope to see replicated across the board.
Fantastic. Thank you, Jamie. That's a great specific example, and we'll look forward to seeing it develop. So thank you. Who else would like to weigh in on this?
Yeah, this is Monsieur from Gavi. I think, 15 years ago, Gavi was developed, and it still holds true that we are a public-private partnership in terms of we do have the not just pharmaceutical industries involved and who have played a key role in helping us shape making sure there's adequate supply and consistent supply of vaccines at affordable costs for governments. We see a greater role for organizations across divides, really, to basically shape markets effectively. So that talks to the providing great incentive for private sector input, but we also see a greater role for civil society to really challenge the status quo. And I think what we're seeing here, and touching on Jamie's point, is really development of those leaders and people, both at the global level and at the country level too, who are well versed in understanding the specific challenges that are facing when you do bring two different sort of organizations across divides, the public and private sector together. And you see a lot of work, and I think that's the point I was made earlier, is that you see a lot of work already within countries. A lot of countries are developing their own leaders from the private sector, from the public sector, and are working together. Nigeria has the Private Sector Health Alliance of Nigeria, which is a way of really fostering innovation at the country level. We see a lot of work going on in South Asia, in particular India, about innovations in processes. And I think the role of the public-private, the role of an organization that's really a public-private organization is really to convene those different stakeholders together, provide the right incentives, and making sure that there is a transparent process in which these organizations, in a safe way, to really collaborate. What we're really looking at is driving innovation in thought. I think the hard innovation, as you say, technology, is already out there. We're looking at innovation in thought, and we're looking you know, in Gavi's strategy, we're moving forward to 2016 to 2020. There is a strong role for the private sector, civil society, and other different organisations to really come together and to understand what are those. So, in essence, it's really continuing and building upon the work that's gone on by individuals across organisations, across sectors, and really now start to see that meshing happening. So there's infusion of public sector thinking and public sector principles within the private sector, and we've seen, from both Remel and Jenny in terms of how they are, Jamie, and how they are taking a long-term view of their operations within certain markets, and also within the public sector, infusing some of that private sector thinking into how they might respond to different challenges as they arise.
Great, thank you, Mas.
Yes, maybe I can add a few thoughts on that. For us, we are the United Nations Population Fund. For us, is first understand the challenge in the next decades ahead. We will be releasing 18th of November the State of the World Population because we are ultimately serving the people. We have challenges in demographics. We will have the largest cohort of adolescents, nearly 2 billion. We have challenges regarding conflicts, humanitarian situation going on. We have challenges about climate change affecting, the world is becoming a small village. And what is happening in the US or in Sierra Leone, as we can see, can affect any part of the world. And we also have challenges of human rights violation. I think for me, the key things in the role, the way we can see the role of the public, the partner, and the other organization is how do we address those who are left out? Because in any setting, whether it is here in the US or in Sierra Leone, in Malawi or Indonesia, there are subset of population who enjoy more or less the human right and what we can call as services, good health services. But there are always pockets of inequality, pocket of marginalized people. So the way I see the challenges in the next decade to come is how do we collaborate all together to address those who are left behind. And I think to Jamie's point, it requires great leadership. It requires great leadership in organization. It requires great leadership in countries. And even in non-governmental organization, to make this as a priority, so that if we want a better world for all of us, these are some of the things we need to be doing. Fantastic.
Thank you, Senan. Emil, I think you have the last word.
Thank you. I know that this doesn't normally happen. To your point, Michael, your original point about the roles of the private sector, NGOs, public sector, how that evolves over time. I'm not sure the roles particularly will evolve that much because, to my earlier point, I think people are there's a great appetite to work together now, and we're learning how to do that. I think what will change more dramatically, more quickly over the coming years is ways of working. I think there will be an increased understanding from the private sector of the objectives of the NGO sector, of the objectives of the public sector, and a much more flexible approach and ways of working together will emerge. So, I mean, I completely agree with Jamie about leadership, and the future leader of our organizations will be completely different to the leaders that were in the past. At GSK, we've instigated a program called Pulse, where our high potential but senior leaders spend 6 months working in an NGO on the ground in a developing world, so that when they come back, they have a completely different mindset and they challenge the organization. So we've had in total something like 500 of these leaders cycle through this program, and they come back into the company and they really shake things up, to be honest with you. They have great ideas, etc. And so I think so we're challenging ourselves, and that changes the way that we work. It changes our desire to really understand what's the objectives of Gavi? What's the objectives of the WHO? What's the objectives of the Ministry of Health in Kenya? And how do we work together with them? So I think that it's not so much will the roles change dramatically. I think that what will happen is you'll see increasing partnerships, different ways of working, different leadership. And I think to bring it back to the whole point about systems and healthcare systems and how you strengthen them, I think this is where the gaps are, and this is the model, this collaboration between the 3 or 4 different sectors, you know, private, public, not-for-profits, etc., above country organisations like the UN, etc. That's the power where if we can change each other's languages, if we can align on shared objectives, and we can change leadership, then I think that's what's going to tackle these really tough problems which we haven't been able to really crack so far.
Great, thank you. You've left us at a fairly hopeful point, so I'm happy to end there. But I really, really want to thank our guests today, Maz Siddiqui from Gavi, the Vaccine Alliance, Ramil Burden from GSK, Jamie Taylor from Janssen Global Public Health, and Dr. Senan Houghton from the United Nations Population Fund. Thank you all so much for joining today. I think this has been a fascinating discussion. You've clearly got your work cut out for you.
Great, thank you.
Thank you. Thanks.
And we'll look forward to hearing more about it. Thank you all for joining.